We are grateful to have you on. I know how busy you are. This is a really extraordinary set of circumstances. People entrusted with protecting the public health, kicking the warnings down the line so that Americans wouldn't know there was potential danger from these vaccines. Your initial thoughts of what you turned up?
Well, first of all, let me give credit where credit is due. I mean, people like you, Naomi Wolf, Amy Kelly, the people who wrote the Pfizer papers, and people that, and again, I'm already leaving and forgetting off names, but there are a lot of people who are digging. And, this particular hearing, again, this is just the tip of the iceberg. This particular hearing was the FOIA requests on the Pfizer papers about the 17-point talking points memo that was completely redacted, which raised my suspicion. So people already got a lot of these documents under FOIA, but they were heavily redacted, so we don't know what was underneath. What we were able to do is build upon those investigations, upon that journalism, and then we could request those exact same documents unredacted, and it's what is under the redactions that's pretty revealing. What's interesting about that 17-page talking points memo is there was no reason for that be redacted. There's really nothing revealing under that. It's just the talking points.
No.
So we heard ad nauseum from administration officials. But again, it just raises suspicion. But what we did find out is that without a doubt, the FDA, the CDC, NIH, they understood, they knew about the myocarditis signal. We already knew that Israeli officials had contacted them at the end of February. But I think probably the real smoking gun is internally, as they were discussing whether or not to issue a warning on the Health Alert Network on myocarditis in mid-May. They had internal discussions, and a question was asked, do we have a signal on myocarditis? And the answer was for young men, the answer is yes. And then a few days later, they decided not to issue the HAN. They issued a lower level notice. And even in that lower level notice, there was discussions whether or not they should advise doctors that any of their myocarditis patients, they ought to avoid strenuous exercise for, I think, 3 months. And even that was removed. So when they finally did issue the weakened notice, they didn't even warn doctors how dangerous myocarditis could be. And, not every doctor is a cardiologist. Not every doctor knows how life-threatening myocarditis can be. So again, to me, it's obvious. It's been obvious. I mean, I was following VAERS early on. I was being censored. We now know that the federal government is behind a lot of that censorship on social media. So there will be more disclosures. This was just really the first report we could issue based on documents that we got that have been obtained by others, heavily redacted. We got them unredacted. And again, I got to give a lot of credit to people, again, like Naomi Wolf, Amy Kelly, you, Ed Berkowitz. I mean, there's a bunch of people that have done a lot of good work.
Oh,
well,
thank you, sir.
And sir, these are agencies that are entrusted with public health. They had to have known that there would be intrepid and tenacious lawmakers like yourself who were ultimately going to get their hands on documents like this. Why did they do it?
I don't think they do understand that. Let's face it, there aren't many people like me and John Solomon. I mean, there just aren't that many people that are inquisitive. I mean, most people, when it comes to the pandemic, just wanted it over and they want to forget about it. I mean, if you're one of the ones that got the COVID injection, you don't want to hear about the fact that maybe these things are causing cancer. Maybe there's long-term implications. Maybe that mRNA is still circulating in your body. The spike protein produced by that mRNA still in your body. People don't want to know that. They just really want to move on. And so, no, I think our federal health officials, I think so many government bureaucrats, they just are arrogant. They don't recognize the fact that the American public pays for their salaries. They pay for the studies. And for example, vSafe. Aaron Siri testified about that again yesterday. I mean, this was set up specifically to monitor safety signals for the COVID vaccine. 10 million people voluntarily signed up for this mobile application app, and they didn't release the information. Aaron Siri had to go to court. It took him 2 years to sue the federal government to find out, well, what did that vSafe, which, by the way, what they asked was really weak tea. I mean, it was really not designed to really see safety signals. But even within that weakened state, the results were astonishing. 25% of the people, of the 10 million people, 25% missed a day of work or school. Almost 8% sought medical care, a majority of those 2 or 3 times. So, I mean, that's pretty serious. I mean, and they completely hid that. And they had to go to court. You know, FOIA, John, you know this. You shouldn't have to go to court for FOIA. It's a law. You know, you request the information, the government ought to turn it over. But no, you've always got to go to court, and a judge has to order it. And what's really frustrating for me as a member of the Senate, a representative of the people who has constitutional authority and oversight, they completely blow us off. I've got 70 some oversight letters in on this, and other people through the courts got the FOIA documents. I didn't get this stuff.
Crazy. It's insane. Sir, it is clear now that these officials chose some political or personal interest over the public health mandate that they had. Is there some criminal or civil liability for officials who delayed the notifications and potentially put other people's lives in jeopardy?
It's hard to say. Right now, my job is to uncover and expose the truth. And John, that's hard enough. I mean, we already have indications that Tom Shimabukuro probably destroyed documents. Maybe I'm going too far there, but you know, communications from him were part of our subpoena. First reaction was, well, we don't have any communications from Tom Shimabukuro. Well, he was central to safety surveillance. Couldn't even find out whether he was still working. I do know that HHS, I think their Office of Inspector General has gone down to interview him. We have referred his name and his actions to Pam Bondi and Kash Patel at the Department of Justice and the FBI. I'm not sure where that goes, because the records that he may have destroyed, those were under our demands to preserve all records. You know, in amongst those 70 some oversight letters, I had multiple demands to preserve records. That should have been filtered down to the key personnel. That certainly would have included Tom Shimabukuro. So no matter what GS level he is, he should have been retaining all those records, and it doesn't appear that he did.